So the initial management is activity modification. So if you notice that your pain gets worse with certain movements, sometimes there isn't a clear pattern, but if there is any sort of pattern, whether it's reaching up to grab something, whether it's sleeping, whether it's bending forward to grab something or put on your shoes, any of these type of movements, you want to modify those movements so it does not bother you, or it bothers you as little as possible. Whenever possible, you want to maintain a neutral spine position. So no slouching, no gardening. You really want to support yourself when sitting. You want to maintain that neutral spine position whenever possible. No flexion, no extension. And then we're going to give you some pain-free mid-range movements that you can work with. So the goal here is to reduce the irritation on those tissues that are causing your pain while keeping you active. And so we want you to still do as much as you can do, but we really need to modify your activities so we don't irritate those tissues, which causes problems. So here are the motor control and isometric exercises that you can start doing in order to help with this pain pattern. The first is the supine core bracing. So basically what you're doing is you're just finding your core. So that's your belly, that's your side bodies, that's your back, it's your diaphragm, it's your pelvic floor, it's this entire barrel here around the stomach. And you want to brace that. You basically want to engage all of those muscles and do a 10-second hold and do 10 reps of that. You can modulate the intensity. So you don't want to do 100% effort. You want to do an effort that you can hold for those 10 seconds. And you want to do this frequently, at least 3 times a day, but if possible, do it every few hours. Next is the gluteal sets. So basically you're just squeezing your butt. You're squeezing your butt for about 5 seconds and you're doing that 10 times. Again, do this at least 3 times a day or up to every 3 hours. And similar to the previous one, you modulate the intensity. So you don't squeeze your butt so hard that it's difficult to do for 5 seconds. You just do enough to allow yourself to feel it, but not to overdo it. And last one is the ankle pumps. This is pretty easy. You're just pointing your feet and then bringing your toes back towards your head, pointing and bringing back towards your head. These are called ankle pumps. You can do as many or as little as you like of these. This is just to keep mobility, keep the blood circulating. So you want to do this as frequently as you can, at least 3 times a day. So if there's no improvement after 2 weeks, then and if there are if there are any new neurological deficits, so any weakness or numbness, and if your pain becomes more severe, then you're probably going to need some, to expand your care team, you're probably going to need some direct care. Like I said, the complex radiating pain is very difficult to manage. But if you do these exercises, if you're diligent with them, oftentimes you can get an improvement here.